Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to be going over how to use a walking exercise to help improve your patellofemoral pains. This one's right out of my book on knee pain and out of our crash course on how to use healing exercises to help your knee regenerate, improve its mechanics, and decrease its pain. Hope you enjoy it. So before we begin this exercise, keep in mind that all healing exercises have to be specific for your unique body, your unique biomechanics and postural issues. So if you haven't yet gone to the Pain Free and Fit or Posture Size websites to take our free body analysis, I'd strongly suggest that because you need to know what your tendencies are before you can plug them into any healing exercise. Otherwise, if you're just using generic exercises that aren't specific for your body, you'll probably only be strengthening your biomechanical faults, and that will lead to more musculoskeletal stress and pain and injury. So, being that we understand what our unique postural issues are and we can really focus on that during walking, it's a great way to use our corrections during those steps each day. We take about 10,000 steps a day, so why not use those steps in terms of an exercise to practice, not with every step, but periodically through the day as we walk with some of our steps to help relieve knee pain from patellofemoral joint stress. So let's begin by understanding what we're going to do as we're swinging the leg forward to take a step. For those of you who have a externally rotated leg on one side, and most people do, okay, you'll know that from our previous videos or from your analysis, that leg will have a tendency to have its hip joint move forward and outward in the socket. And there'll be a whole fascial and muscular pattern of tightness supporting the leg wanting to turn outwards and move forwards. So on the swing, as we're reaching for our step in our normal walking pattern, we want to emphasize that backwards movement of that top of the thigh bone. If you go to your top of your thigh, there is a hard nodule there. It's the only real prominent hardness on the side of your hip. It's about the size of a golf ball. If you put your finger behind that and another finger in front, as you take a step forward, you want to have that pressure increase going backwards, not forwards. Because the typical problem is, as you walk with the swing, you'll notice there's a lot more hip flexor activity, and the glute muscle, which is the buttock muscle from behind, is not stabilizing the hip enough. So there's an overactivity of forward motion in the hip. So we want to keep a little bit of tail under tension, which, remember, if you have low back pain, you don't want to put that under too much to cause pain. Just a little tension, which engages your abs. That allows you to grab your glute and use your glute to stabilize that hip. As the hip flexors move forward, you'll feel that hard bone on the side of your hip, the greater trochanter, move slightly backwards into your finger. Also, if you have a tendency to externally rotate that leg, you'll want to make sure that your knee and foot are facing straight forward. On the swing phase, as you're about to make contact, also make sure that your kneecap and foot are pointing the same direction. Those of you who typically have an externally rotated hip may also have an externally rotated knee, where the foot has a tendency to angle out more than the knee, and they're not in the same direction. So on the swing phase, as you're about to land and coming through from the last step, you want to make sure that that shin bone is rotated so that the kneecap and the foot are in the same alignment pattern. When you contact, if you contact with your heel first, that's going to have a tendency to cause more pronation. Remember, pronation is the turning of the foot inwards, the heel that tilts in. So if you're landing with heel contact first, you're going to have a lot more force to be able to pronate. And we don't want to do that because pronation is associated with a lot of stress at the knee. So as we're making contact with the floor, we want to make sure that we're trying to make contact with more of a flat-footed stance, meaning that as opposed to having my heel forward here, I want to be landing with my whole body above my foot. Do you see my ear, shoulder, hip, knee, foot? It's all in a straight alignment pattern. That's a mid-stance landing. When I do that, it's a lot less likely for my foot to pronate inwards. I can maintain equal contact on all 4 points of my feet, but we really have to emphasize, as we're first making contact with the floor, that we're avoiding that knee, which remember we were holding in if it was externally rotated, from that shin turning in too far, because that will be associated with pronation. So on the swing, as you're reaching through, we want to turn the shin in to make sure the foot and the knee is aligned. But as we contact, we're kind of breaking that turning in and almost causing a little turning out tension, not movement, to make sure that that whole shin and heel doesn't turn inwards or roll inwards in a pronation. What we do want to have making contact on the inner edge of our leg as we land is we want to have a tension with the big ball of our foot, because as we're landing, if we're holding a little more tension on the outside of the heel to avoid the tendency to pronate, which is good, we want to counter that with a little bit of tension with that big ball down. So as you're first loading your weight on your foot, you're thinking, I have a little more tension on the outside of the heel, a little more tension on the inside of the forefoot. That allows you to maintain that 4-point balance. That's going to take a lot of stress out of the typical foot problem of moving in and causing that valgus or that knock knee posture that drives the kneecap out, laterally tracts it, and disturbs patellofemoral joint pain. As you're making contact, you also want to be thinking that the whole knee is held out to the side. The typical tendency when pronation happens is the whole knee wants to fall in. So if we think about holding it slightly out, more of a tension than movement, it helps us to ensure that that knee isn't caving in out of alignment. We always want to make sure the center of the hip, the knee, and the foot is in alignment. As the whole knee joint is held out, we want to tense the kneecap slightly in. Again, that's a previous video. We have that documented for you if you subscribe to our channel. We have a bunch of videos on how to increase the tension of that VMO at the kneecap without tensing the whole thigh or the adductor muscles. So knee joint is out as a whole, but kneecap tension is in. Now we have the foot and the knee in a stable position. The last part of it is what's going on in our hip. As we're loading that weight onto our foot, our buttock is contracting. Remember, we already had the tail under tension and squeezing that butt to drive the leg back in the hip. So it's easy because the glute's already partially recruited. Now it's recruited, squeezing that butt stronger. And finally, we want to push tall as we step. Hip hiking, which is the tendency to swing your hip up on contact, is going to be a big part of what's driving that stress to the knee, causing IT band problems, abnormal tension at the kneecap, and causing lateral tracking. So we want to think as we're hitting on that step right underneath our hip moves down and our ribs move up to avoid the typical tendency of not only hip hiking but rib leaning. If you watch someone with a really bad patellofemoral problem, most of the time on that side upon contact, they're going to have a hip swing or hip hike and a slight rib tendency to lean into that side. So we want that side to be tall. That properly engages our hip muscles, spares the stress to our knee, takes a lot of stress off our patellofemoral joint. And we also want to plug in the fascial connections from the opposite shoulder. You know, walking is both an upper, mid, and lower body activity. So as we make contact with that foot, the opposite arm should have the palm in and the shoulder blade should not be rounded. As we take a step, the glute muscle that's going to drive this leg down tall and eventually back so our next foot can swing forward, the glute muscle attaches to the opposite lat muscle from the shoulder. And the two work together to drive this motion. So if we're having a typical rounded shoulder posture on contact with the opposite limb, that's stretching that lat, that's stretching that rhomboid, causing abnormal tension throughout the serratus, across the external oblique, and into our pelvis. So there's a whole sling from the opposite shoulder down to the hip that's involved in making contact. So we want to make sure that shoulder is in a good neutral position so it can assist properly the normal mechanics running across the mid-body and spine to the pelvis. So when you practice this, remember, you don't want to try to do this all 10,000 steps of each day. That's a little too much. Your muscles are going to be sore. But pepper it in as you walk through the day, maybe 4, 5, 6 steps, 8 steps. Practice it, then forget about it for the next few, then plug it in for a step or two. There's a lot of points to this, so don't try to do them all at once. At the beginning, focus on maybe a foot correction for the first few steps, then maybe what's happening at my knee, then a few steps later what's happening to my hip. And over the weeks of practicing this, you'll begin to mesh all these points together so you actually include them with each step of your gait cycle. If you like this video, I invite you to subscribe to our channel. We have a bunch more on patellofemoral pain that you can use. If you'd like to help me share this with others to help with their pain, please give me a like or a comment below. If you have any questions, I'll do my best to get back to you. Hope this helps you with your patellofemoral joint pain.